Hi, my name is Dr. Michele Friday. I'm a cardiologist, a heart doctor, and honored to have this opportunity to talk to you about why the entire month of February is designated by the American Heart Association as American Heart Month. No, it is not just about romantic love with chocolates and flowers and dinner for two, but more importantly, this is a month to stress love and care of our hearts, to help us live the best healthy life that we can, and to feel truly content. Heart disease is the #1 killer for both men and women. Our theme this year at King's Daughters is Be Kind to Your Heart. The first Friday of February, this year it's going to be Friday, February the 4th, Wear Red Day, is specifically designed to raise awareness in women that we are not spared from heart disease. It is not just a man's disease, and it is in fact the #1 killer for women also, more than cancer. Every adult should therefore find ways this month to educate themselves on their risk of having a catastrophic event, men and women. So please listen up. I encourage everyone now to pause, stop what you're doing, and think about your own possible risk and the risk of your loved ones for having and dying of a heart attack. Every 36 seconds, one person dies in the US from heart disease, and 1 in 4 deaths in the US is from heart disease. 2 out of 10 deaths with heart disease occur in people that are less than 65. In fact, we see that people in their 30s and 40s are coming in with significant heart disease and presenting to the hospital having a heart attack. More concerning is the delay in seeking help, and we see 25% of people having a heart attack die before getting to the hospital because they do not realize that they're having a heart attack. I implore you all to recognize the symptoms of having a heart attack and react. Call 911. Now that I've given the sober facts of heart disease in the United States, I would like to share some good news. There is good news. 80% of heart disease is preventable if you are kind to your heart. That means we can do something to lower your risks. How, you ask? Let us talk about the ways to be kind to our hearts. Know about heart disease, prevent heart disease, recognize the symptoms, and react if you're having a heart attack. I strongly encourage all to be proactive. Know your risks. What are your numbers? Are your numbers abnormal? Diabetes. What are your blood sugars? Are your blood sugars high? Hypertension. Do you know what your blood pressure is? High cholesterol. Has your provider checked your cholesterol? Smoking. We all know that this is not good for your lungs and your heart. A family history of heart attack. Does someone in your family have a history of heart disease, stents, open heart surgery? Please get checked out. Women should note the following specific to our sex that increases our risk of having a heart disease or a bad outcome. Early menopause. If you've gone through menopause in your 30s and 40s, we have smaller bodies, smaller arteries, and it takes less plaque to cause significant disease. And we delay in diagnosis because we are too busy taking care of the kids, our parents, families, husbands. In the last 2 years, we've all experienced the pandemic, and it is apparent that the virus for COVID-19 affects the heart, causing blood clots, weak heart muscle, inflammation of the muscle of the heart in some people, and does add stress to the heart. Vaccination is our best defense. Social distancing, wearing a mask or two, sanitizing your hands often, these things are necessary to avoid the serious consequences of COVID. Know that the symptoms of heart disease varies from person to person. Do not ignore. Seek advice of your doctor or provider. Don't rely on lay advice from a relative. If you're having chest discomfort, arm pain, jaw pain, pain between the shoulder blades, It could be pressure and not pain. If you have shortness of breath with exertion, just extreme fatigue, cold sweats with activity, like after you come out of the shower, just feeling abnormally dizzy, having heartburn, swelling in your ankles, heart fluttering. These are some of the symptoms of significant heart disease, and I urge you to get checked out. So now that you know the symptoms and the risk, let's talk about what you can do to help your heart. Lifestyle changes. This can reduce the risk of having heart disease by 80%. So what can we do? Eat healthy foods, vegetables, and I'm not talking about potatoes and corn, white meats, vegetables and fruit. Exercise. Try to maintain a healthy weight. I cannot tell you enough that we really need to quit sugary drinks, drinking pop, soda, diet drinks, sweet teas. Try to drink at least 6 to 8 glasses of water a day. Monitor your blood pressure and your cholesterol. And most of all, reduce stress. Life has gotten so busy with lots of stresses, and often we go it alone. The good times are few and far between. Meals together with a family, sitting on the porch with friends, playing games together, singing songs loud in the shower, and laughing about the good old days. Not much time for all of this. How did we get to be so busy in our lives? I urge you all to do the following. Smile more often, breathe deeply in your day, and laugh. Avoid working non-stop. Try to take breaks. Surround yourself with a clean, fresh, uncluttered, pleasant environment. Avoid smoke-filled rooms. Spend time with low-maintenance people. Let go of the need to always control. We spend so much energy trying to control people and situations that are often out of our hands. Let us take control of ourselves. Enjoy hobbies, find a new skill, reach out to longtime friends such as high school friends, college friends, co-workers. Sit in silence and just think. Try to invest in your well-being. This February, be kind to your heart. King's Daughters has readily available appointments to see one of our 16 cardiologists and our cardiac-trained advanced practitioners. We have several appointments available and ready. Do not delay. Time is muscle. Slow down this month, this year more so. Continue to find ways to be kind to your heart, your health, your mental well-being, and your body. Your heart will thank you